I think a couple of questions. Dr. Faryal first.
Excellent talk, Dr. Hussein. We always recommend, surgeon to see our patients. Anyway, how long should we wait? And I am a nephrologist, but I deal with patients with, diabetes and diabetic nephropathy. How long should we wait? With all the, the results that you're giving us, why shouldn't it be recommended early on?
Well,
surgery.
The question to you is multifold. I mean, research into this found that, for example, in the US, only 2% of those who are candidate for bariatric or metabolic surgery are actually referred to a bariatric surgeon. The hurdles to this is numerous. So first of all, there's reluctance from the patient to undergo bariatric surgery. The second is there's reluctance from the GPs or specialists to refer these patients to bariatric surgery. So unless we overcome the stigma, unless we show the result of bariatric surgery, we show that it's actually safe, take away the stigma that people die after bariatric surgery, you will find reluctance. Regarding how long should you wait, it's my humbled opinion that you should not wait, because I would rather operate on somebody with pre-diabetes, spare them even starting insulin, to give them the maximum benefit and stop these long-term complications from happening in the first place. When it comes to nephropathy, as I showed you the results, I mean, this is new, by the way. These are all within the last 2 years, because in the past we used to say that we don't know whether it affects the kidney or not. And we started noticing that after doing the surgery, the GFR and all that improve. And these people highlighted that by their long-term follow-up. So it's exciting. It's an exciting field, exciting times. And I have to say, more endocrinologists are starting to refer patients. Dr. Ghazi, Dr. Faryal, I think you guys have questions.
Dr. Faryal, you want to? But in any case, I think we are really living an exciting time with the new development. Most of I think, endocrinologists, they were depressed before because before the bariatric surgery, because you just give insulin and the patient never improve, develop microvascular and macrovascular complication, and the patient, they die at the end, okay? But we are now really in a time which is really with bariatric surgery and the improvement in the medical management. This will be really, do you want to be inside? Now, I think the bariatric surgery is evolving, yes. But I'm amazed of the tonicity of the beta cell. You see, Dr. Nasser showed us a graph, which is probably an older graph, which shows, without surgery, which shows that the declining capacity of the beta cell to secrete insulin, and the end, zero, almost. But after bariatric surgery, suddenly we discover that this beta cell wake up again. And possibly the changes of the hormone, what we say, and you suggested, that possibly will be 10 year, 20 year, and the complication will return. But that's debatable. We're waiting to see the factor which really led to deterioration. And that's, I think it is an evolving section of medicine. I really believe, that diabetes will be cured in the future. Now we have more than 600 million in the world, and we have more than 200,000 in Bahrain. And I expect we are facing a very bright time and brighter future. And the factor, as you suggested, the data is there, okay? So I'm optimistic. But I'm sorry, I'm telling Dr. Nasser, avoid insulin. Insulin is a dangerous drug. Huh? You don't believe it. Huh? And I think even retinopathy is caused by insulin. It stimulates the muscle. You see, all the hypertension, all the problem occur mostly sugar and insulin. And I think,
Sure. Thank you, Dr. Ghazi, for this very informative comment. I mean, again, I would like to go back to the point I was trying to make initially. It's very exciting times. I mean, we do not talk about surgery against medications or whatever. Now all the research is about how they can complement each other. So we're talking about giving medication preoperatively to reduce the fatty liver, to reduce sleep apnea, to reduce the perioperative risk, to improve the weight loss. We're talking about combination, as Dr. Nasser illustrated. Now, we know that the best weight loss is achieved by a combination of surgery and medication to give the maximum weight loss. We're talking about the role of medications when weight comes back after surgery. I do a bypass or I do a PPD. There's nothing after, and it's the maximum. If weight comes back, what to do? Then there is a role. So it's all about integration now instead of antagonizing. Dr. Frial, I think you had a question, sorry.
I just want to say that that's a great talk, Amr, as usual.
Thank you very much.
My opinion regarding the surgery with the delay in the complication, and I agree with you that the earlier the better, because I think there is no reversibility of the complications.
Absolutely.
After the surgery. There is an improvement, yes, but there is no reversibility. That's why the sooner the better to
Absolutely.
refer for bariatric surgery. And even if the weight came back, the medication we use after the
Yes.
coming back is chicken dose, like in comparison to pre-surgery. We
Absolutely.
use one drug and no insulin, and I think the earlier the better is the answer.
Absolutely, absolutely. I totally agree with you, and that's why, again, for these patients, I tell them, yes, you stopped your medications, but my advice is you still need to follow up with your endocrinologist at least every 6 months, maximum a year. You need to have your checkups, and you need to have your complication checked as well. All right.
Okay, no further questions, so we will conclude this session. I want to thank all the speakers, Dr. Nasser and Dr. Amr, and audience, thank you.
Thank you very much. Shukran, Dr. Amr.